Have you ever taken a medication, thinking it was helping you, only to find out later that it might have been harming your body? It's a scary thought, but the truth is, some of the most commonly used medications can quietly damage your kidneys without you even realizing it. Your kidneys work around the clock to filter toxins, balance fluids, and keep your body running smoothly. But as we age, they become more vulnerable to stress, making it even more important to know which medications could be putting them at risk. Some drugs, when taken too often or in high doses, can reduce kidney function, cause dangerous waste buildup, and even lead to kidney failure over time. So today, we're breaking down 6 common medications that could be silently harming your kidneys, what they are, how they affect your health, and what you can do to protect yourself. Let's get started. Number 1. Antibiotics. Antibiotics are some of the most widely prescribed medications, used to treat bacterial infections like pneumonia, urinary tract infections, UTIs, and skin infections. While they can be life-saving, certain antibiotics pose a serious risk to kidney health. The reason is that some of these drugs are nephrotoxic, meaning they can damage kidney cells and impair their function. Among the most harmful are aminoglycosides, such as gentamicin and tobramycin, which can build up in kidney tissues and cause cell death. Vancomycin, another commonly used antibiotic, has been linked to kidney inflammation, while polymyxins can damage kidney cell membranes, increasing the risk of kidney failure. While some antibiotics, like beta-lactams, penicillins, and cephalosporins, are generally considered safer alternatives, they still require careful monitoring, especially in people with pre-existing kidney issues. So, how exactly do these medications harm the kidneys? The problem starts when antibiotics accumulate in the kidney tissues, leading to inflammation and cellular damage. Over time, this can cause acute tubular necrosis, ATN, a condition where kidney tubules die, making it difficult for the kidneys to filter waste properly. The risk increases if antibiotics are overused or misused, such as when they're prescribed unnecessarily for viral infections like the flu or common cold. The FDA has issued warnings about the risks of certain antibiotics, emphasizing the need for caution. To protect your kidneys, always follow the prescribed dosage, avoid self-medicating, and ask your doctor if an antibiotic is truly necessary. Staying hydrated is also key, as drinking plenty of water helps your kidneys flush out the medication more effectively. When taken responsibly, antibiotics can be highly effective, but knowing their risks and using them wisely can help safeguard your kidney health. Number 2. NSAIDs. Nonsteroidal anti-inflammatory drugs, NSAIDs, are some of the most commonly used medications in the world. They help relieve pain, reduce inflammation, and bring down fevers, making them a go-to option for headaches, arthritis, muscle pain, and even menstrual cramps. Popular NSAIDs include ibuprofen, Advil, Motrin, naproxen, Aleve, aspirin, and celecoxib, Celebrex. While these medications are widely available over the counter and seem harmless, regular or excessive use can quietly damage your kidneys over time. NSAIDs work by blocking COX-1 and COX-2 enzymes, which help produce substances that cause inflammation and pain. However, these same enzymes also play an essential role in maintaining proper kidney function. When they are blocked, kidney blood flow is reduced, which can lead to acute kidney injury, AKI, a condition where the kidneys suddenly lose their ability to filter waste properly. AKI can develop within just a few days of NSAID use, especially if taken in high doses or for extended periods. Long-term use is even more concerning. Studies show that chronic NSAID use significantly increases the risk of chronic kidney disease, CKD, gradually reducing kidney function over time. NSAIDs also impair sodium and water excretion, leading to fluid retention, swelling, and high blood pressure, all of which put additional stress on the kidneys. A 2006 study found that NSAID users had a 26% increased risk of AKI, and chronic use has been linked to 1% to 5% of daily users experiencing kidney injury worldwide. Certain groups are at a higher risk of kidney damage from NSAIDs, including people over 60, those with pre-existing kidney disease or diabetes, and individuals taking ACE inhibitors or diuretics. To protect your kidneys, it's best to use the lowest effective dose for the shortest time possible. If you have a high risk of kidney problems, consider acetaminophen, Tylenol, as a safer alternative. Always check with your doctor before using NSAIDs regularly to ensure you're not unknowingly putting your kidneys at risk. Number 3. Diuretics. Diuretics, commonly known as water pills, are widely prescribed to help the body remove excess fluid. They are commonly used to treat high blood pressure, heart failure, and edema, fluid retention, caused by kidney or liver disease. By increasing urine output, diuretics help reduce swelling and lower blood pressure, making them essential for many individuals. Some of the most commonly used diuretics include hydrochlorothiazide, HCTZ, furosemide, Lasix, and spironolactone, aldactone. While diuretics can be beneficial, improper use or prolonged intake can negatively impact kidney health. One of the biggest risks with diuretics is dehydration and electrolyte imbalance. Because these medications work by forcing the kidneys to expel more water and salt, excessive use can lead to dehydration, dizziness, and kidney stress. If your body loses too much water, your kidneys struggle to filter waste efficiently, which can increase the risk of acute kidney injury, AKI. In fact, a hospital study found that 27.5% of AKI cases were linked to diuretic use. Another major concern is electrolyte imbalances. Some diuretics, like furosemide and hydrochlorothiazide, cause low potassium levels, hypokalemia, leading to muscle weakness, irregular heartbeats, and kidney stress. Others, like spironolactone, can raise potassium levels, hyperkalemia, which is equally dangerous, as high potassium can cause heart and kidney complications. If not monitored properly, long-term diuretic use may contribute to chronic kidney disease, CKD. To protect your kidneys while taking diuretics, it's crucial to stay hydrated and regularly monitor your kidney function and electrolyte levels. Always use diuretics under medical supervision, especially if you are taking other medications that affect kidney function, such as NSAIDs or ACE inhibitors. By managing diuretic use carefully, you can avoid unnecessary harm to your kidneys while still benefiting from their intended effects. Number 4. Proton pump inhibitors, PPIs. Proton pump inhibitors, PPIs, are among the most commonly prescribed medications for acid reflux, GERD, gastroesophageal reflux disease, and stomach ulcers. They work by reducing stomach acid production, providing relief from heartburn and preventing damage to the esophagus. Popular PPIs include omeprazole, Prilosec, esomeprazole, Nexium, and lansoprazole, Prevacid. While these drugs can be very effective, long-term use has been linked to serious kidney complications. One of the most concerning risks associated with PPIs is acute interstitial nephritis, AIN, a kidney disorder characterized by inflammation in the spaces between kidney tubules. AIN can cause symptoms like fatigue, swelling, and decreased urine output, but in many cases, kidney damage progresses silently until function is significantly impaired. Left untreated, AIN can lead to long-term kidney dysfunction and even chronic kidney disease, CKD. Studies have shown that long-term PPI use increases the risk of CKD by 1.2 times compared to non-users. While this may seem like a small increase, millions of people take PPIs regularly, making this a widespread concern. Another overlooked side effect of prolonged PPI use is low magnesium levels, hypomagnesemia, which can cause muscle spasms, irregular heartbeats, and kidney stress. Magnesium is essential for maintaining electrolyte balance, and deficiencies may accelerate kidney damage over time. To protect your kidneys, it's important to use PPIs only for the shortest time necessary. If you need long-term acid reflux treatment, H2 blockers like ranitidine or famotidine may be safer alternatives. If you must take PPIs regularly, monitor your kidney function and magnesium levels through routine checkups. By being cautious, you can relieve stomach issues without putting your kidney health at risk. Number 5. ACE inhibitors. ACE inhibitors, angiotensin-converting enzyme inhibitors, are widely prescribed to manage high blood pressure, heart failure, and kidney disease. These medications work by relaxing blood vessels, lowering blood pressure, and reducing the strain on the heart and kidneys. Some of the most common ACE inhibitors include lisinopril, enalapril, and ramipril. While these drugs are often recommended to protect kidney function in people with diabetes or high blood pressure, they can still pose risks, especially when not used properly. One of the primary ways ACE inhibitors affect the kidneys is by temporarily lowering kidney function. By relaxing blood vessels, these drugs can reduce blood flow to the kidneys, which may cause a slight decline in filtration rate, eGFR. For most people, this effect is mild and reversible, but in some cases, kidney function may drop too much, leading to acute kidney injury, AKI, particularly if ACE inhibitors are taken with NSAIDs or in a dehydrated state. Another potential concern is hyperkalemia, high potassium levels. ACE inhibitors reduce the kidney's ability to remove potassium efficiently, which can lead to dangerously high levels in the blood. Too much potassium can cause irregular heartbeats, muscle weakness, and even life-threatening complications. This risk increases in people with pre-existing kidney disease or those taking potassium supplements, diuretics, or NSAIDs. To safely use ACE inhibitors, it's essential to stay well hydrated and monitor kidney function regularly through blood tests. Routine potassium level checks are also crucial to avoid dangerous imbalances. If you experience symptoms like severe fatigue, muscle weakness, or irregular heartbeats, consult your doctor immediately. While ACE inhibitors can be life-saving for many, understanding their potential risks ensures you're protecting both your heart and your kidneys. Number 6. Lithium. Lithium is a widely prescribed medication used to treat bipolar disorder and mood disorders, helping to stabilize extreme mood swings and prevent manic or depressive episodes. It is a life-saving drug for many people, but long-term use can have serious effects on kidney health. The most commonly prescribed forms include lithium carbonate, Escalith, Lithobid. While highly effective for mental health, lithium requires careful monitoring due to its impact on the kidneys. One of the primary concerns with lithium use is its link to nephrogenic diabetes insipidus, NDI, a condition in which the kidneys lose their ability to concentrate urine properly. This leads to excessive thirst and frequent urination, which can, over time, strain the kidneys and increase the risk of dehydration. If left unmanaged, prolonged lithium use can cause irreversible kidney damage, eventually leading to end-stage renal disease, ESRD, where the kidneys lose function completely. At this stage, dialysis or a kidney transplant may become necessary. The risk of kidney damage increases with the duration and dosage of lithium use, which is why regular monitoring is crucial. People taking lithium should have yearly kidney function tests, including glomerular filtration rate, GFR, and creatinine level checks, to detect any early signs of kidney impairment. To reduce kidney risks while taking lithium, It's essential to stay hydrated and maintain proper sodium intake. Dehydration can cause lithium levels in the blood to rise dangerously, increasing toxicity and further harming the kidneys. If you're on lithium therapy, working closely with your doctor to monitor both mental health and kidney function is key to balancing its benefits and risks. Your kidneys play a vital role in filtering toxins and maintaining overall health, but certain medications can silently harm them over time. Antibiotics, NSAIDs, diuretics, PPIs, ACE inhibitors, and lithium are commonly used drugs that, when misused or taken long-term, can lead to acute kidney injury, AKI, chronic kidney disease, CKD, or even kidney failure. To protect your kidneys, it's crucial to stay hydrated, monitor kidney function regularly, and consult your doctor before taking any high-risk medications. If you're currently using any of these drugs, talk to your healthcare provider about safer alternatives or dosage adjustments. Your health is in your hands. Like, share, and subscribe for more valuable health tips, and stay informed to keep your kidneys and your body functioning at their best.